Hi, everyone. Thanks for checking out this webinar here. We're on our third out of 6 webinars in this series. We'll be discussing the Mediterranean diet in this webinar. Again, my name is Addie Lears. I'm a graduate student at Concordia College in Moorhead, Minnesota. I did my graduate capstone research on weight management practices in elite athletes. So I'll just be sharing what research is out there on the Mediterranean diet for weight management in elite athletes. To start, we'll go through our learning objectives. So objective 1, we'll be able to define the Mediterranean diet in terms of weight management. Objective 2, understand the reasons why elite athletes may be interested in using the Mediterranean diet to assist with weight management. And objective 3, be aware of the research that is currently available on the use of the Mediterranean diet to assist with weight loss and weight maintenance. So I'm sure everyone has heard of what the Mediterranean diet is, but we'll just go over a brief definition like usual. So the Mediterranean diet, again, is an eating style that incorporates foods that people who reside along the Mediterranean Sea commonly eat. So what are those foods? It emphasizes the consumption of minimally processed foods, plant foods, seafood, healthy fats like those avocados, olive oil, and then using herbs and spices rather than salt. So now that we know, that definition, why might elite athletes be interested in using the Mediterranean diet to assist with weight management? Well, there is a lot of research on this diet just with, association with those decreased rates of metabolic syndrome, cardiovascular disease, cerebrovascular disease, so a lot of those chronic diseases. But then it's also been shown that higher consumption of low saturated fat foods and foods rich in those bioactive compounds have been shown to have anti-inflammatory effects, which may be of interest to athletes who are wanting to enhance their performance. It's also a commonly used diet for weight maintenance in the general public. It's a commonly prescribed diet by providers. So it should be no surprise, that some athletes may be interested in this diet. Unlike past webinars in this series that discuss weight loss first, we're actually going to discuss what research is available on the Mediterranean diet for weight maintenance, because that's actually where the bulk of the research has been done. So we'll discuss 2 studies here. The first of those studies was published in 2019 by Baker and colleagues. This study used a randomized sequence crossover design. It examined 11 participants who consumed a Mediterranean diet and a Western diet for 4 days. These dietary intervention periods were separated by a washout period of 9 to 16 days. After participants followed each dietary intervention period, they had an exercise test conducted the day after the intervention ended. Energy intake for this diet was, or for both diets of this study, was just participants' usual intake. This was determined by a 3-day food diary analysis that was performed by a dietitian before the study started. So participants were given instructions on serving sizes and recommended food frequencies for each dietary pattern. They also recorded their intake through MyFitnessPal, and this was again analyzed by a dietitian just to ensure compliance with the dietary intervention they were on. Participants did not have to follow a specific macronutrient distribution. Again, they were just following their usual intake. Same with resistance training. So they just followed the same pattern of activity for both intervention periods. They also were instructed not to perform any unusually, vigorous or long duration exercise for at least 48 hours before the test. This study did not examine body composition at all. It just measured performance. So the exercise tests that were conducted after the dietary intervention periods were a 5-kilometer treadmill timed run to measure endurance performance, a Wingate anaerobic test to measure anaerobic exercise performance, a vertical jump test to measure power, and then a hand grip strength test to measure strength. Participants' heart rate was also monitored throughout these exercise tests, and their rate of perceived exertion was measured via the Borg RPE scale. To detect differences between these two dietary interventions, a paired t-test was run. Results of this study did find that participants had a 6% faster time for the 5 kilometer performance run after following the Mediterranean diet compared to the Western diet. Interestingly, this improvement in endurance exercise performance also occurred without participants' heart rate increasing or the rate of perceived exertion increasing. However, no differences in exercise performance were noted for the Wingate anaerobic cycle test, the vertical jump test, or the hand grip strength test between the two dietary interventions. It should be mentioned that this study had several limitations that may have influenced the results. The first being that this study only used 4-day dietary intervention periods, which is considered short-term and subchronic. Therefore, it left, the long-term effects unknown. This study also did not control participants' intake or activity during the intervention, which ultimately could have affected how participants performed in these exercise tests. However, a few years later, Ficarra and colleagues published a study that did look into the long-term effects of a Mediterranean diet on body composition and performance. This longitudinal experimental study examined the effects of a Mediterranean diet combined with CrossFit training in 22 trained male and female adults. So these participants were divided into two groups, the Mediterranean diet group and then the control diet group. And they followed this assigned dietary pattern for 8 weeks. Their daily energy intake was based on their total energy expenditure, which was calculated using the Harris-Benedict equation to find their basal metabolic rate. This was then multiplied by an activity factor of 2 to find that total energy expenditures. Macros varied depending on the participant's training load. So in general, they have the same carbohydrate intake. So 50% of their daily intake was dedicated to those carbs. Protein was where it really varied. So 1.4 to 2 grams per kilogram body weight per day was that range, again, depending on their training load. Then fat was just the remaining calories after carbohydrates and protein. So resistance training details, the participants just kept performing their usual CrossFit training program. And then they had the following tests administered before and after this dietary pattern to assess body composition and performance. So for body composition, it was analyzed via body impedance analyzer. And then they also had body circumference measured. For performance, it was measured by a Wingate test, and this was to evaluate that maximum anaerobic power. And they had performance tests done of the following exercise. So squat jump, counter movement jump, and a 30-second jump test. They also examined 3 CrossFit specific exercises. Just like the last study discussed, differences between dietary groups were examined via a paired t-test. So results from the study found that there were no variations in body composition between the Mediterranean diet group and the control diet group. However, there were improvements observed for squat performance, power, muscular endurance, anaerobic power, and CrossFit-specific performance in the Mediterranean diet group. So both these studies did find some performance measures were different or improved, I should say, for the Mediterranean diet compared to a normal diet or a Western diet. This study did have limitations as well. It should be mentioned that the control group did not actually have a controlled diet. So although they were just following their usual diet, this actually may not have been meeting their needs. The Mediterranean diet intervention group in this study had their energy intake and their macros individualized to their total energy expenditure. So this could have impacted the results. Both these studies also had limited sample sizes. But, taking it all together, the results from Baker and Ficarra both suggest that a healthy dietary pattern like the Mediterranean diet can be useful and safe for athletes looking to maintain that body composition and possibly even enhance performance. Again, there's not much research yet on Mediterranean diet in athletes, but these two studies are pretty promising for that no negative effects have been noticed on body composition, but again, possibly enhancing performance, which is always a plus. Switching our attention now to research on the Mediterranean diet for weight loss. So, although there are many long term health benefits associated with adherence to the Mediterranean diet, the efficacy of the Mediterranean diet for weight loss is not as clear. So, there's currently no studies available that actually examine the effects of a hypocaloric Mediterranean diet on body composition and performance in the athlete population. That being said, there has been a systematic review published. This was published in 2016 by Mancini and colleagues. It assessed 5 studies that all examined the effects of the Mediterranean diet in overweight and obese individuals. So again, not the athlete population. However, this review did find that the Mediterranean diet produced similar reductions in weight and improvements in cardiovascular risk level factors as those following a low carbohydrate diet, a low fat diet, or the American Diabetes Association diet. So did produce, weight reduction and improvements in those CVD risk factors, but no different from those other 3 diets. So kind of in conclusion here, again, that Mediterranean diet, it emphasizes consumption of minimally processed foods, plant foods, seafoods, healthy fats. And this is why it is, a commonly prescribed diet for the general public and like patient, groups, and can be used in athletes. So the research, out there currently that we discussed by Baker and colleagues, and then Fakara and colleagues, found that the Mediterranean diet did enhance performance without negatively impacting participants' body compositions. Therefore, the Mediterranean diet may be a beneficial diet for elite athletes wanting to maintain, a healthy lifestyle while still being able to perform at their peak level. As always, if you have any questions, please contact me at my email, addison.lears99@gmail.com. I'd also like to remind you that there is a webinar series available for elite athletes themselves. So if they are, asking any questions about the Mediterranean diet, send them on that way and it will explain all the research that's out there for them and, things to consider before starting the diet. Here is my reference page if you want to do any more digging on this diet. And then we have our webinar assessment tool. So press pause when you're ready and you can jot down your answers for these 4 questions. Then once you're done, press play and the webinar will take you to the webinar assessment tool answer key for the 4 questions. So you'll find the answers there. As always, have a great rest of your day, and we will see you for the next webinar in this webinar series, which will be discussing a plant-based dietary pattern for weight management.